1027, 1035, WICY, your feel-good favorites from the 80s and more. And joining us here, of course, on a Wednesday around 9:40, it's Dr. Todd Whitman from Hyde Medical Center and CVPH. And Todd, every week we've chatted. We've been moving in the right direction, and I think this is great stuff. So first of all, how are things going with you?
Very well, thanks, and I appreciate being with you today.
Yeah, absolutely. We're going to talk about some advice on reopening as we move into and through Phase 3, eventually on to Phase 4.
Yeah, well, I've got to say we're so grateful to be talking about reopening and moving into Phase 3 in New York State. I just want to reiterate that our outstanding success in flattening the curve in the North Country really resulted from our community's willingness to restrict their activities and social distance, wear masks, frequently wash their hands. These things are so important, and I just want to remind people that we can't let up on our efforts at this point. As we start to reopen, other people are going to be coming to our communities from downstate and other places. They're undoubtedly and unknowingly going to bring COVID back to our communities, and so we want to just make sure we continue to do all those things that helped us to flatten the curve in the first place.
So you're saying we're going to have it could be, though, very limited given our efforts.
We hope so, and if we continue with the efforts that we've had, hopefully it'll just stay a flat curve with a few cases here and there, and we won't have big surges.
God bless parents, Todd. Lately, they've had to deal with their children, not being in school for even the last few months already, and now you got the whole summer as well. Summertime and children, it's something you got to keep mind of, huh?
Boy, it really is. Everybody's anxious to get the kids out and get them engaged and doing things. We just need to remember to do it in a safe manner. Lots of the camps and other things that kids may have participated in are either going to be virtual or some of them won't take place at all. And so it's important to find safe ways for kids to get out there. And we need to continue to do all those safe activities that gave us the success that we've had so far.
How should we look at, the dynamics of, family and friends during this whole reopening?
It's an interesting question. There's, everybody's different in their comfort level of reopening at this point. And, particularly people who are immunosuppressed or elderly or, high risk for getting COVID. Even though we're reopening, lots of people continue to have some anxiety around, what comes next for them. I think it's really important that we remember that every individual has a different comfort level. Their boundaries and guidelines around reopening are going to be different than mine or yours. And so we want to appreciate that unique aspect and just let every person reopen in a way that's comfortable for them and not to push people to beyond their comfort zone.
Yeah, some people are going to be, or in some businesses will take longer than others. As long as they're ready, they have to be prepared. Again, there's a lot of steps, isn't there?
Absolutely. It's a moving process. And, it's going to be ups and downs. We may have times when there's a little bit of a surge and we have to pull back a little, or, we may be full guns ahead as we've been recently in the North Country. We're so lucky.
I know. All right, Todd, is that all you have for us today?
That's all I've got for right now, unless you've got any other questions.
No, I think that's going to do it. Of course, we do get updated from Dr. Todd Whitman every single week from the Hyde Medical Center of the University of Vermont Health Network. And thanks again so much for your time, Todd.
Sure. You have a great day.
You too. 1027 and 1035 WICY.